If you're gearing up for the NCLEX, you already know that hematology and oncology questions can feel like some of the toughest ones on the whole exam. Well, today, we're going to pull back the curtain and show you exactly how to conquer them.
Okay, let's jump right in. The very first thing you have to get is this. It's not about memorizing a massive list of chemo drugs. The NCLEX doesn't care about that. It's designed to test if you understand timing and, most importantly, how to protect your patient. And here's why that's so incredibly important. On the floor and on the exam, your number one job is anticipation. If you can't see the complications coming, you can't protect anyone. The NCLEX directly connects your ability to anticipate what could go wrong with being a safe nurse. And yeah, that has a huge impact on your score.
So the bottom line is this. The exam is really a test of your judgment. Can you spot the most urgent problem in a sea of information and know what to do first? That's the skill they're looking for. So, over the next few minutes, we're going to give you a quick preview of the framework we use inside Exam Coaches to build that exact kind of clinical judgment, the kind the board's looking for when it comes to hematology management. Let's start by breaking down why these questions seem to trip so many people up. What is the actual challenge here?
Does any of this sound familiar? So many students get lost in the weeds, you know? They're memorizing drug names but totally missing the big picture of safety. They mix up the precautions for chemo versus radiation, they don't catch those critical red flags for infection or bleeding, and they just fail to see those major side effects coming. That is a perfect recipe for getting these tough questions wrong.
And this is exactly where you need to flip your thinking. Success isn't about knowing a therapy schedule by heart. It's about seeing the very first sign of a complication and knowing the number one action you have to take right then and there.
Okay, so let's see how a structured framework can actually bring some clarity to all this complexity. We're going to start with the big one, chemotherapy.
Now, what's so powerful about this is how it organizes the chaos. Instead of a random mile-long list of side effects, we simplify. You see a question about chemo? Your brain should immediately jump to these key systems. Myelosuppression means you are laser-focused on infection, fatigue, and bleeding. GI tract issues? You're worried about fluid and electrolyte imbalance. This structure trains your brain to think in terms of risk and priority, automatically. Let's apply it. Here's a classic NCLEX scenario for you. Your patient's absolute neutrophil count, their ANC, is in the danger zone after chemo. In that split second, what is your single most important priority?
See, a framework immediately guides your thinking. Step 1, you recognize this patient is at an extreme risk for a life-threatening infection. Step 2, you act on that risk by putting strict aseptic techniques in place. But what comes next? What's step 3 and 4? That's where the full framework comes in. But for now, let's keep it moving.
Next up, radiation. The risks here are different, but the way we think about it, that structured process, it's exactly the same.
With radiation, our focus shifts big time to skin integrity. We're watching for damage and teaching the patient those gentle care protocols. We're also managing things like fatigue, and a huge area the NCLEX loves to test is source safety. You absolutely have to know the difference in precautions between an internal radiation source, called Brachytherapy, and an external beam. This system makes those differences crystal clear.
So, let's do another quick one. A patient getting radiation tells you the treatment site is super red and really tender. What is the very first thing you have to assess?
And again, our priority framework points the way. Before you do anything else, you must assess for skin breakdown. Is that skin integrity compromised? That one assessment dictates every single action that comes next. Step 2 is putting protective care in place, but that full intervention plan, that's what we build out inside the platform.
And finally, let's look at bone marrow transplantation, or BMT. This is where the risks really get compounded, and honestly, the stakes are at their absolute highest.
For a BMT patient, these safety alerts are non-negotiable. Infection risk is now off the charts, so we need strict isolation. Bleeding precautions are still vital, but now we add this massive, new, life-threatening risk, rejection. You have to be constantly looking for the earliest signs of tissue rejection. It's a lot to juggle, but thinking this way keeps your priorities straight.
All right, here's a subtle one, but it is so critical. Your post-BMT patient develops a rash and some diarrhea. Now, to the untrained eye, these might seem like two separate minor issues. But what major complication should be setting off alarm bells in your head right now?
This is that next level NCLEX thinking. In a BMT patient, that specific combo of symptoms, rash and diarrhea, means you must immediately filter for graft versus host disease, or GVHD. Your next priority is to start monitoring for rejection. This is how you connect the dots and spot a life-threatening emergency before it gets out of control.
So, we've looked at chemotherapy, radiation, and BMT. They all have their own unique risks, their own side effects, their own interventions. But what's the one single idea that ties all of them together?
It all comes down to this. Whether it's chemo, radiation, or BMT, your thinking process stays the same. You have to anticipate the most likely complications, you have to monitor for the earliest signs, and you must always prioritize patient safety. That is the heart of safe nursing, and it is the key to passing the NCLEX. And this is how we do it. Inside Exam Coaches, we don't treat these as three separate, isolated topics. They are woven together into a single, unified system for managing hematology patients. You learn to see the connections and patterns, not just memorize a bunch of different facts.
Okay, let's wrap this up. What is the big takeaway from everything we just talked about?
Look, our goal isn't just to teach you a list of therapy names. We train you in the most critical skill there is, complication recognition. We train you to lock in on those priority interventions so you can build real, confident NCLEX-level judgment in hematology. Because at the end of the day, remember what the NCLEX is all about. It has one mission, to see if you are a safe nurse. And on that exam, the safest, most timely action is always the highest scoring answer. What you saw today was just a quick peek. The full, comprehensive framework for mastering hematology management is waiting for you inside the platform. We'll see you there.